Naturopathic medicine is considered to be an alternative medicine and is categorized as a pseudoscience practice. In simple terms, naturopathy is misunderstood to not be based on any scientific evidence whatsoever. But note, just because it is not based on scientific research doesn't mean that it doesn't work. In fact, naturopathic medicine is such a big subject that it can't be categorized under one heading. This is because naturopathic medicine combines modern treatment with traditional methods and includes famous practices like acupuncture, herbal medicine, and homeopathy. In your life, you would have heard these terms at least once, right? This is because naturopathic medicine has been documented by medical news to not only treat, but also heal many sort of diseases. These illnesses include cardiovascular diseases, musculoskeletal pain, type 2 diabetes, polycystic ovary syndrome, chronic illnesses, and yes, it is even shown to be effective against depression and anxiety. With all this being said, we should not underestimate the power of naturopathic medicine, despite it being categorized under pseudoscience. But how does naturopathy work? Well, for starters, naturopathic medicine is all about education and prevention of illnesses in your body. For this to happen, naturopathy focuses on three main things. These are: number 1, the body's capacity to heal itself; number 2, preventing health problems; and finally, number 3, a personal responsibility to optimize health. As a rule of thumb, if you want to use these three principles to prevent illnesses in your body, then naturopathy recommends that you prioritize diet, exercise, and finally stress management. If you want to take this a step further and get a custom naturopathic medical care plan built just for you, then we recommend you visit a naturopathic doctor. There are three main types of naturopathy doctors. First type is just general healthcare advisors, like dentists that use naturopathic methods in some of their treatments. Second type of naturopathic doctors are traditional naturopaths. These doctors don't hold a license and so aren't accepted by all. And finally, the third type of naturopathic doctors are licensed naturopathy doctors. In order to get their license, they go through 4 years of naturopathic medical school to get a widely recognized license. So, on an obvious note, if you do decide to get a naturopathic medical treatment plan made specifically for your body, then we recommend going to the third type of naturopathic doctors who are licensed and experienced. Now, even though each doctor is different, but at the end of the day, they are all following the same principles and guidelines. So, when you do go to a naturopathic doctor, this is what you should expect. Firstly, they will begin by diagnosing you. This means they will study your personal habits, like diet, stress levels, and overall lifestyle habits that can affect your body and mind. Along with this personal information, they might also diagnose you through physical assessments, laboratory tests, medical imaging, and your medical history checkups. Only and only after a strong diagnosis has been done on you will the naturopathic doctor now start making a medical treatment plan specially tailored for you. What this medical care plan essentially tells you is how to prevent and treat your personal health problems using the natural healing power of your own body. Most of the time, this involves food and nutrition charts tailored specially for your needs. For a very basic example, suppose your diagnosis shows that you eat a lot of processed foods. Then the naturopathic doctor might make a medical care plan for you, which recommends that you eat whole foods only, like fruits, vegetables, lean meat, and whole grains. Along with diet and nutrition recommendations, your medical care plan may also include behavioral change, such as exercise and lifestyle, homeopathy, hydrotherapy, manipulative therapy, herbal medicine, detoxification, and psychotherapy. According to a 2020 study done by the International Journal of Yoga, patients of type 2 diabetes who followed a custom-built naturopathic medical care plan recovered significantly from this illness, with a large decrease in their postprandial blood glucose levels. Likewise, a 2007 study found that herbal medicines made from devil's claws, white willow, and bark act as natural painkillers, to significantly reduce pain. Another 2018 research concluded that naturopathy, such as acupuncture and acupressure, help to control all the different problems people face after having an operation, like vomiting and nausea. Also, as part of this 2018 research, stress and anxiety that comes after an operation were shown to be treated through aromatherapy and naturopathic music. So, it's clear that even though certain parts of naturopathic medicine may not be supported by science, but there are many studies which show it to be an effective way of preventing chronic diseases. But the bonus question still stands: why use naturopathic medicine when you can use synthetic medicines, which are backed up by science and treat the same diseases? Well, the simple answer is because naturopathic medicine is all natural and only relies on the healing power of your own body. This means that you don't introduce any artificial substance into your body, but heal your body using its own power and the power of Mother Nature. So, in summary, the naturopathic medicine is a not-so-pseudoscientific practice, as we have just discovered in today's video. This is because it is such a big topic that covers areas like herbal medicine, acupuncture, and homeopathy. But with that being said, naturopathy is still a controversial field, and just to be on the safe side, we still recommend that you consult your doctor before trying out any of these naturopathic treatments. If you have tried any of the naturopathy methods shown in today's video, or know someone who has, then we would love to know your experience in the comments below. If you like this video, then make sure to subscribe for more videos like this, and we will see you in our next video.